HIV/AIDS still a taboo in Pakistan. Lack of discussion leads to discrimination. That's why the number of HIV patients is increasing rapidly in Pakistan. A report launched by UNAID and Ministry of Health has alarming statistics and shocking. According to this report, 132,000 patients of HIV are in Pakistan, including 6,000 in the capital.
Today, UNAID and Ministry of Health are going to launch a detailed report. So let's see what they have to show.
Now we have with us Sayyid Muazzam Ali Shah, who is Joint Secretary at Ministry of National Health Services, Regulation and Coordination. Shah Sahab, what was your initial reaction when you gone through this report?
That's a very good question, because for the last survey was done in 2011, and there was a lot of time that has passed since the last survey was done, and this survey has really opened the eyes, because there is a significant increase in not only in the percentages, but the worrying trend is that it is upward trend. So that
how significant this report would be for you, being a rep of this health ministry, to make measures or to take measures?
Because for making any strategy or to make any informed decision, you have to have some kind of a robust data. So this report will go a long way in revisiting our strategy that we are already working on under the leadership of the ministry and as well as the Achak Zaisa, and that will definitely help a lot to focus on the specific areas that need attentions. And because that reports had diverted brought attention of the government on the specific areas, like especially the youth that are being at risk, and that is we have to have a robust strategy for that, to not only to keep our population and youth protected, but also for the economic development of the country.
Sir, do you think HIV is still a taboo in Pakistan?
HIV, I suppose that
because you mentioned in your speech the lack of discussion and awareness.
Yes, of course, there has been some increase in the awareness over the past years, but still, due to our particular socio-cultural setup, and we have some kind of taboo issues that are making some problems in directly taking this problem head on.
Would you like to highlight a couple of your steps your ministry taken to overcome this issue?
We have given more autonomy and more to our national programs, and we are also planning to involve the youth in this.
To overcome this issue.
Yes.
Last question. As this is an international issue, this HIV/AIDS, but unfortunately Pakistan among the few who has huge number of affectees. So how do you see cooperation of different international agencies, especially UN agencies, to overcome this issue?
Yes, we are very thankful to our development partners like UNAID and WHO and UNICEF, who are constantly with us in eradicating or this problem, and we are looking forward to the continued support from these partners.
Thank you so much, chief guest of the event. So now we have with us Mr. Neil Bone, who is UN resident coordinator. Mr. Bone, what was your first reaction when you saw this report?
Well, I was worried because, Pakistan over the years has done a reasonable job in dealing with AIDS, but like many other countries around the world, the same pattern is happening here, which is that you have AIDS spreading amongst certain vulnerable populations, but the study shows that that spread is now moving from some of those most vulnerable populations to populations that interact with more people, which means that the risk of HIV moving into the mainstream population is higher than it was when the last time a study was done, which was 5 years ago.
So these alarming statistics, what is your opinion? What are the main causes behind this?
Well, I think the difficulty is that often the groups in society who have HIV are on the fringe of society and they're stigmatized. You need to accept them. You need to accept that you need to work with people, whether they're injectable drug users, whether they're female sex workers, whether they're men who have sex with men. They are people and they have rights, and if you engage with them, it's much more likely that the epidemic is concentrated. If you don't, experience shows from around the world that it moves into the mainstream population as it did in much of Africa, and then the social costs are tremendous.
So you think it's still a taboo in Pakistan?
I think it's moving beyond the taboo. I think it is spoken about much more, but nonetheless, the society does not have such experience in engaging with groups that are a bit outside the mainstream. And everywhere, I've worked in 5 or 6 countries around the world on AIDS issues, and you need to engage with these people who are on the outside so that they're on the inside and that programs reach them.
How do you see government's role to tackle this issue?
Well, I think government has actually taken a leadership role. The fact that this report was commissioned by government, the fact that, the minister's photo is up there behind the report, indicates that they are willing to accept what's in the report and to give some leadership and action to deal with the recommendations.
How would you like to explain UN role in UN different agencies to tackle this issue?
Well, the UN recognizes that it's an issue that cuts across different boundaries. So UNAID, which is the umbrella organization, brings it all together, but UNAID draws on experience from UNICEF, from the World Health Organization, from the UN Development Program, from a number of other organizations as well.
Thank you so much, Mr. Neil Bone. Thank you. So viewers, now we have with us man behind the scene, the guy, the agency who brought all these alarming statistics of HIV. Let's talk to him and see what he has to say. Dr. Memdu Sehu, Country Director, UNAIDS. Thank you so much for sparing your time. Doctor, tell me something. How significant this report is to overcome this issue?
This report is a fact, an evidence, a basis of discussion. This report is data. This report is exactly human being. It's very clear that the epidemic is well shown in this report in terms of progressing from people who inject drug users to sexual network. Sexual network mean all people who are engaging in sex. That's why this report is very important for us.
Would you like to highlight few salient features of this report in terms of statistics or other alarming conditions you think?
Yes, the first clarity is the number of the prevalence among key population, call it most at-risk population, is growing. For example, female sex workers, the baseline was 0% and right now it is 2.2%. Men who have sex with men, the baseline was 0%, right now it's 5%. Transgender people, the baseline was 0%, right now it is 7%. Men working on sex, calling men sex workers, the baseline is 0 and 95%. So we have the evidence that the new HIV cases, determinants of this transmission and factors of this transmission are linked to poverty. People are worried about how to get job, unemployment, and to do sex as work. Second, people are absolutely committed in injecting drug users. Why they inject drug users? Because the context of their psychology. So the conditions to spreading the HIV is linked to the behavioral of people. People are sometimes a kind of need to get drugs. And if you get drugs and the syringe are not very clean, you can transmit the virus.
Poverty is one issue.
Poverty is
And
one
do you
issue.
think HIV/AIDS is still a taboo in Pakistan?
Yes, absolutely. From I was here 2 years ago. I recognize that everywhere, even including Pakistan, sexual is not easy to talk. It's a taboo. It's right. That's why we need to find intelligence methodology of discussion with people, basically young people.
How would you generate that debate in
The
among
debate must said we have to look at disease linked to sexual transmission, not for playing game, not for doing anything. We have to say, young people, for example, let's move to be a very, very high people with values, to be a Pakistanis who is working well without any disease problem, rather than using sex are players, are transmissions. I know absolutely it's right. The Islamic culture, I'm a Muslim, it's absolutely clear we have to be careful about sex. It's not talking to people how to do sex, where to do sex. We have to discuss this matter in terms of disease, in terms of getting dignity, getting equality, getting gender sensitive to all, in terms of respect of human being, not in playing game.
How do you see government's role to overcome this issue? And have you suggested anything government to start any campaign, especially awareness campaign?
Yes, government must start awareness campaign. Government must take the lead. Government must do what I'm saying.
Is it taking?
Take the risk and take the lead, because without government, we cannot move. Government must coach people and key leaders, key religious, key communities to be on track. The communities themselves must take awareness in a way about HIV and take the lead. The response is not only the government. The government can put money, PC1 for example. But as I say, every time
Your government can make a campaign, especially because it is related to awareness. Lack of discussion, even your guests mentioned during their speeches. So it's because of lack of discussion, lack of awareness. Have you suggested government such campaign?
absolutely, we are here for question, for helping the government to do this government. That's why we need the media like you. We take the opportunity to thank them well, because we read a lot of commitment from the media groups. Which government can take the lead, but the private sector can take the lead. The community can take the lead. The partners can take the lead. So it is a sharing responsibility and global solidarity. It's not only one part. It's all constituencies who must on board.
Last question, as it's an international issue, how do you see the role of UN agencies, yourself and others?
UN is very clear. All the people who are working on HIV as under the umbrella of UNAIDS. It was created since 1966 in order to coordinate and to harmonize all UN actors. UN, including UNS, UNICEF, WHO, UNEP, all this UN have what I'm calling a division of labor under the umbrella of UNS. So in the UN, the mission, the mandate of UNS is to coordinate, to facilitate, and to keep the money available and try to distribute this money. That is the role of UNS. We have the lead in monitoring evaluation, advocacy, leadership, and supporting the technical assistance on this epidemic.
Thank you, Dr. Sahu,
Thank you very much.
Country Director, UNAIDS. Thank you so
very
much.
Thank you.
So viewers, now we have with us Dr. Basir Khan Achakzi, who is host of this event and National Program Manager, AIDS Control Program, Ministry of National Health Services, Regulation and Coordination. Dr. Achakzi, thank you so much for sparing your time and giving us the opportunity to cover this event. So how was your reaction, first reaction, when you saw this alarming report?
Actually, from the day first, when we started this IBBS and mapping exercise in Pakistan, we knew that there are certain pockets, there are certain spots which have not been explored so far in the past 70 years. So we tried our level best. Our team was trained to explore each and every spot where these key population people lives. Yes, of course, it is a alarming situation for us, and we have to combat this.
How significant this report would be for you being head of this AIDS control program to overcome this issue?
It is a very, very important, very and relevant report, and this report is telling us the ministry, the program, the UN partner, the civil society organization, that which action should be taken and how the government should prioritize their activities to prevent HIV/AIDS and spreading in general population. So we are cognizant.
Is it because you are the head of this program? Is it still taboo in Pakistan talking on HIV, AIDS, and all that?
Yes, this is a great issue. For example, if 130,000 plus people are suffering from HIV/AIDS, which is an estimation by UN agencies, and we so far only been able to register 22 or 23,000 people. It means that the people are not coming for testing, the people are not coming for treatment. So a very huge stigma and discrimination is attached to this disease. It is my appeal to the nation, to the people, that HIV is a disease. It is a viral disease. It could be prevented if you start your treatment. It could not be transmitted if a HIV positive patient is having ARVs to treatment. He or she cannot then transmit this to another individual.
What you, as a representative of government, are doing to tackle this issue? Have you started any awareness campaign? Have you, this ministry, started anything practically?
The awareness campaign, as far as the government is concerned, we have done advocacy events with parliamentarians, with the religious peoples, with school teachers, with policy makers, with the opinion leaders. But you know, this is a very expensive job. For HIV response in Pakistan, we need more than $115 million. But currently we have just $35 million, which has been provided to us by Global Fund. And the local part, the local provincial government allocation is not of that extent that we will address each and every patient in Pakistan.
So as this is an international issue, so do you get any support from international organization, UN agencies? Do you get any kind of support, technical or financial, from them?
Yes, it is the prime responsibility of the UN agencies to provide me and the program, the technical support. UNAID, WHO, UNICEF, UNODC, and other UN agencies, UNDP, UNFPA, they are providing us technical support, but they are not donors. The donors are sitting outside the line. So we are appealing to the UN agencies to jointly play a role to attract the donor agencies to support Pakistan HIV/AIDS program.
As you are head of National AIDS Control Program, so any message to viewers, if you can look at camera and give any message to people?
My request to the people will be that HIV/AIDS patient is a human being. You please, if you want to hate, you hate the disease, not the human being. Whatsoever his background or her background is, please support them. Please ask them to come for HIV testing and treatment, which is completely free by the government of Pakistan.
Can these viewers see any practical measures taken by you in future?
We have established more than 50 treatment and testing centers in Pakistan, all over the provinces. So please come over there. We are there to support you. We will not discriminate you. The healthcare provider is always there to support our HIV patient for testing and for treatment free of cost.
Dr. Achakzai, thank you so much for spending your time. Thank you, sir.
Now we have Dr. Sayyida Batul Mazhar, in charge program of pregnant women at PIMS of HIV. So ma'am, what was your first reaction when you came to see about the report?
We are running a PPTCT center, which is a center for prevention of transmission of HIV from the parent to the child. So we are running this program at PIMS in the MCS center PIMS. And the purpose of this is that we treat the women who are suffering from HIV in such a manner by giving them drugs and following the best practices, so that the transfer to the newborn of HIV is reduced to a minimum and hopefully zero. And so far we have treated more than 100 women in PIMS who have delivered in PIMS, and none of their children had HIV because of optimum management during pregnancy and delivery.
So ma'am, what do you think, what are the causes of increasing number of HIV in Pakistan?
It is basically the transmitted mainly in the drug abusers who use intravenous drugs. It is also through the sex workers, both the female sex workers as well as the male sex workers, so as well as hijras. These are the key populations. And what we see in PIMS is basically women who are pregnant and who belong to this population or the spouses of such men. So we provide services for them.
Ma'am, do you think this HIV is still a taboo in Pakistan?
HIV is a taboo, but once it is diagnosed, it is treatable and they can have a long, healthy life, and they should not be suffering from it and not transferring it. It is possible to manage it very well and have a good life with good treatment.
Thank you, ma'am. Thank you so much.